we've worked to stay ahead, and that's why today I'm unveiling a plan to root out, to stop, and to contain COVID-19. Let me begin by saying I'm so proud of the community's work throughout all of this. The aggressive steps we've taken are nothing if we don't have buy-in and participation and sacrifice from each and every member of this community. And because of you, we are where we are today, where the curve of admissions to hospitals is flat. It's not where we wish it were, but it's also much better, much better than where we could have been. As I've said before, when dealing with a disaster, whether it's a hurricane, a flood, a fire, a pandemic in this instance, the one thing you never get back is time. And that's why from day one we've been leaning forward, and we're still leaning forward in our response. You have to go early, you have to go big, and most importantly, you have to be smart about it. And that continues to be our marching cry. That's what folks deserve and expect from us as leaders. That's why we were one of the first counties to order that restaurants and bars close, to impose a stay-home order. That's why we asked folks to wear face coverings, why we've set up our own small business recovery fund, why we set up a medical shelter of last resort at NRG as an insurance policy from surge. But we're not through this. I'm just as eager as anyone to get the economy back up and running. And as we've discussed, the idea is to open the economy and keep it open. If we are not smart in the way we do this, we risk a spike or, at worst, a second surge higher than the first one, like they've seen in other countries. And we risk having to go back to where we started, and we risk losing all of the profound sacrifices that people have made to get us to this point. Yesterday, the governor announced his plan to begin reopening on May 1st, and I appreciate the support he's provided us with NRG, with testing, additional PPE for our community. But as the epicenter of COVID-19 in Texas, we in Harris County can't take our eye off the ball. Frankly, I think that containing this virus will be a tall order given the May 1st timeline. But we're going to do everything we can, move heaven and earth to try and make it work, because we've made so many gains due to profound sacrifices and work from each of you, and we can't put that to waste. We've been working for weeks, day and night, on a structure and a timeline for how to responsibly reopen. And so we are basically implementing that structure we've been developing in a much more compressed timeline, and we're going to do everything we can to try and make it work. With good reason, folks are concerned about there being a second wave, and that's what I'm concerned about too. So that's what this helps guard against. We will do everything possible to preserve what we've accomplished thus far within the governor's structure, and so I have a framework that will help us get there. That doesn't mean that by following this framework necessarily we will succeed, but it will give us our best shot within the circumstances. In order to keep the economy open, once it begins opening, it's vital that we follow a smart framework, a smart containment strategy. And the idea is to ensure our systems are prepared to test, to trace, and to treat people who are sick. So let me run through this briefly. Our approach starts with testing, growing our ability to test, and most importantly, to get tests to where they need to be. Our assessment is that for every person who tests positive, they've had around 20 contacts, and particularly if folks are going to start being out and about a little bit more. And so this is about identifying the first person who is sick and then being able to test the other folks that may be positive. Beginning this week, the county will have the ability to test up to 1,600 residents per day. And as part of this effort, we announced yesterday a strike team that's starting today that goes into nursing homes and congregate settings to test residents, to evaluate practices. This will continue to grow. We also announced additional pop-up locations, which will start on Thursday. So now we have 6 locations, 4 mobile ones, pop-up ones, and 2 fixed ones in Katy and Baytown, in addition to the resources we've brought over on the 2 Walgreens site. We've been burning up the phone lines. We've been lobbying hard for more testing, and we're going to continue to do that. Right now, we're getting there. We think we're pretty much there in terms of being able to test around 20 tests per person who is positive. But of course, if we have too many cases, we'll quickly run out of tests. And also, the more tests we have, the more we can go proactively into areas like congregate settings. So we're going to continue to do that. The most important thing is, in order to test all the new cases and their contacts with existing resources, for us to be safe, it's imperative that we keep the new cases per day at around and below 100, below 100 new cases per day. That's why we rely entirely on each and every one of you, and that's why this framework is the best we have within the circumstances, but it doesn't mean that we need to stop putting in all our efforts. We're just giving our community the best shot we possibly have, given the timeline. Our second approach, the second piece of the framework, involves tracing. Today, I am announcing that Harris County will exponentially expand its contact tracing workforce, which has already been scaled up from pre-COVID levels. As part of the effort, Harris County will recruit around 300 contact tracers with the ability to expand as needed. These are folks who are going to reach out to people who have come into contact with someone who's infected, ensure they get tested, and ensure that they isolate for at least 2 weeks so that they're not spreading the virus. And there it's about containing, limiting the spread of the virus so that it doesn't spread even further. Potential sources of the additional workforce are new hires, contractors, existing Harris County staff, volunteers, all of whom will be recruited and will be trained by experienced epidemiologists and experienced staff. Today at Commissioner's Court, we have an item to hire an army of scientists, experts, and contact tracers to begin working toward that goal of 300 as fast as possible. And so we're going to be hiring basically the supervisors, the most experienced additional people on top of what we already have. And over the next few days, we're going to work furiously to train and onboard folks as fast as possible. This is something that was already underway, but we're doubling up the speed, the resolve, and you can be sure folks are working literally day and night to get this stood up. The final piece is treatment, and this one is tougher, and it's the piece we've discussed several times. Our hospital admissions are not where they need to be. They're not as low as they need to be so that there is enough of a buffer for hospitals to sustain a new wave of cases. That's concerning. But if we're going to move forward, and per the governor, we're going to do it. So to the extent that you minimize contacts, to the extent that you wear masks, that you do your part, we're going to keep our hospitals in a positive position. And that continues to be on all of us. We're constantly in touch with the leaders of our hospital systems. With everybody's work, we flattened that curve, the concern. We're still bumping around 200 admissions every day, which if we tripled every 7 days like we were doing early in our curve, that would quickly run out of capacity. And so that's why we are preserving the option, working on how to have a backup shelter that's local, and also working on just observing those numbers very, very quick, very, very carefully, and asking that the community continue to do their part. Overall, the point is we're doing everything humanly possible to succeed, and we'll continue to do that. As government, we're doing that, and you're doing that as well. We continue to need your sacrifice, your efforts, and your help so that ideally we're able to reopen safely, and we're able to do so without a second spike, without a second wave, and without having to backtrack. If we let our foot off the gas right now, the virus will inevitably come back. And it may come back with as much force, if not more force, as before. Our only real weapon right now is social distancing, face coverings, making sure that we're being prudent with our interactions, that if we feel we may have the virus, we're getting tested so folks can begin identifying and doing this work of contact tracing. Every single piece here depends on you. And this is a war that's very much still going on. So I want folks to know that we are still in the middle of it. We're going to keep going after it. We're going to continue using every tool in the toolbox. We're going to continue working with the best experts that worked with us to develop this framework. And we're going to continue to need your help. I know that both lives and livelihoods are important to the people of Harris County, and that's what this is about. I'll conclude there, repeat my remarks in Spanish, and then Dr. Shaw will give some brief remarks before we answer questions. A lo largo de esta crisis, hemos discutido varias veces una palabra importante y esa es acción. Acción es lo que hemos prometido, es la manera en la cual estamos un paso adelante del virus en lugar de intentar responder. De esa manera somos proactivos y continuamos tomando acción todos los días. La semana pasada empezamos con las coberturas faciales, ayer pruebas adicionales, todos los días algo nuevo que estamos haciendo para contener el virus. Y debemos seguir haciendo eso si queremos contener y eliminar en algún momento este virus de nuestra comunidad. Debemos detenerlo en donde está. Primero quiero agradecerles a todos por su apoyo, por lo que están haciendo. Gracias a su trabajo estamos donde estamos el día hoy, que es una curva que se ha aplanado, no ha bajado a donde nos gustaría, pero tampoco ha subido a tales niveles como se han visto en otras partes. Como he dicho antes, cuando manejamos un desastre, bien sea un huracán, una inundación, explosión química o una pandemia como esta, una cosa que jamás recibimos de más es tiempo. No hay tiempo de sobra. Y por eso desde el primer día de esta crisis hemos estado trabajando en ser proactivos y pensar en qué es lo siguiente, cómo más podemos ser más inteligentes que este virus. Por eso fuimos uno de los primeros condados en Texas de cerrar los restaurantes y los bares, en implementar la orden de quédese en casa. Es por eso que le pedimos a todos que utilizaran mascarillas, coberturas faciales, por eso establecimos un fondo para las pequeñas empresas, creamos un refugio médico, una póliza de seguro en el centro de NRG, pero todavía esto no acaba, estamos prácticamente en la mitad, si mucho. Como todos ustedes, quiero que la economía vaya a reanudarse, que podamos retomar nuestras actividades y por eso es que estamos tomando la estrategia que hemos tomado. Es porque sabemos que si no abrimos o reabrimos la economía poco a poco, de manera paulatina, de manera inteligente, arriesgamos otro pico, arriesgamos otra curva y arriesgamos que esta segunda fase sea peor que la primera. Y arriesgamos el deshacer todo el progreso, todos los sacrificios que ustedes han hecho. Entonces, sé que el gobernador anunció ayer su plan de reabrir muchas partes de la economía el 1 de mayo. Aprecio mucho el apoyo que él nos ha dado en cuanto a más pruebas, también ayudarnos con el refugio médico en NRG, con materiales de protección personal. Pero somos el epicentro del coronavirus en Texas. Aquí en el condado Harris tenemos casos, la mayoría de los casos son más que los otros condados. Estamos realmente en el centro de la crisis y no podemos darnos por vencidos. Realmente, si somos honestos, yo creo que el contener los casos va a ser un poco difícil con este horario del 1 de mayo. Pero no podemos arriesgarnos a eliminar los pasos positivos que ha tomado la comunidad. Entonces estoy comprometida de intentar hacer todo lo humanamente posible porque sea exitoso este paso que está tomando el gobernador. Por muchas semanas ya hemos estado trabajando en una estructura, en un horario para reabrir poco a poco y hemos estado trabajando en estrategias para contener el virus en determinadas áreas, en casos individuales y no tener el virus a lo largo de toda la comunidad. Lo que vamos a tener que hacer es acelerar ese plan, acelerar esas estrategias y lo estamos haciendo, seguiremos trabajando día y noche para intentar que esto sea exitoso porque no podemos simplemente eliminar todo el progreso que se ha hecho. Hay muchas personas que están preocupadas por la opción de una segunda ola de casos. Comparto esa preocupación y es por eso que seguimos tomando estos pasos. Entonces, voy a explicar brevemente lo que es nuestra estructura para responder a esta crisis. Primero, el primer paso son las pruebas. Si queremos reabrir el 1 de mayo, necesitamos una estrategia de pruebas, de rastreo y de tratamiento. Entonces, empezando con las pruebas, se trata de expandir nuestra habilidad de hacer pruebas, de llevar las pruebas a donde deben estar. Por cada caso positivo, nuestros análisis dicen que necesitamos hacerle pruebas a unos 20 contactos. Entonces, empezando esta semana, el condado tendrá la habilidad de hacer hasta 1,600 pruebas al día y continuaremos a abogar por más pruebas. Ayer anunciamos un equipo de ataque para llevar las pruebas a centros de personas mayores, de personas sin hogar, para evaluar las condiciones en esos sitios. Eso empieza el día de hoy. También hemos creado 2 sedes de pruebas adicionales, los cuales empezarán el jueves. Entonces ya tendremos 4 sedes móviles, más las 2 que están, una en Baytown y una en Katy. Hemos trabajado por semanas, hablando por teléfono todo el día, hablando con otros niveles de gobierno, pidiéndoles más pruebas, más capacidad, y relativamente estamos donde queremos estar. Estamos a tal nivel que sí vamos a poder absorber estos casos, hacer las pruebas que se deben hacer, pero obviamente necesitamos más. Entre más podamos hacer, más vamos a poder ser proactivos, hacerle pruebas a personas no solamente que hayan llegado positivas y sus contactos, sino también áreas como centros de retiro y este tipo de lugares. Para poder hacer pruebas a todos los casos nuevos y a los contactos de esos nuevos casos, necesitamos que el número de casos no suba de 100 casos nuevos diarios. Estamos alrededor de eso y es ahí donde nos tienen que ayudar ustedes, porque si llega un punto en el cual simplemente no tenemos suficientes pruebas para evaluar tanto las personas como los contactos de las personas, si es que hay muchas personas diariamente que se están infectando. Entonces, es por eso que necesitamos el apoyo de todos. La segunda parte de nuestra estrategia es el rastreo de los casos. Y como parte de ese esfuerzo, vamos a expandir nuestro equipo de rastreo de una manera exponencial. Vamos a reclutar alrededor de 300 rastreadores con la habilidad de expandir y crecer a como sea necesario. Estas son personas que van a contactar a individuos que hayan estado en contacto con una persona infectada. Les van a hacer la prueba y les van a pedir que se aíslen por 14 días. De esa manera vamos a poder aislar, contener el virus, intentar prevenir que continúe esa expansión y que tengamos que cerrar todo nuevamente. Vamos a contratar trabajadores temporales, contratistas, trabajadores ya del condado, voluntarios, y todas estas personas serán entrenadas por expertos que ya han trabajado con nuestro Departamento de Salud Pública. Ahora, el día de hoy, de hecho, en la Corte de Comisionados vamos a estar aprobando la contratación de científicos, de expertos, de rastreadores, más expertos para ya empezar a movernos hacia esa meta de 300. Y en los días que vienen estaremos trabajando 100% para intentar reclutar y entrenar a esas personas lo más rápido posible, dada el horario del gobernador del 1 de mayo. Finalmente, la última pieza es el tratamiento, y esta pieza es un poco más difícil. Ahí es donde hemos hablado de las admisiones hospitalarias y el hecho de que es necesario de que hayan suficiente espacio en los hospitales para que si se ve un incremento exponencial en esa curva de admisiones, que no se queden sin espacio los hospitales. Lastimosamente no ha bajado la curva a un nivel todavía seguro, está en un nivel preocupante, por ahí unos 200 o más casos al día, admisiones al día que estamos viendo a los hospitales. Eso es preocupante porque si se empezara a triplicar las admisiones cada semana, lo que estaba sucediendo hace un par de semanas aquí en el condado Harris, rápidamente nos quedaríamos sin espacio. Pero dado el plan, pues tenemos que trabajar con lo que tenemos. Estaremos observando ese número muy de cerca, y si hay más indicadores preocupantes, si se empieza a ver que eso empieza a subir, ahí tendremos que hablar con el gobernador y ver qué pasos vamos a tomar. El mensaje principal es que estaremos haciendo todo lo humanamente posible por asegurarnos que protejamos el progreso que hemos logrado en esta comunidad gracias a cada uno de ustedes. Si nos damos por vencidos, si nos relajamos demasiado, el virus definitivamente va a regresar. El virus está acá y la preocupación es que la segunda ola sea peor que la primera. Entonces tenemos que recordar que lo principal, el arma principal que tenemos en esto es el distanciamiento social, el utilizar las coberturas faciales, el poner de nuestra parte para seguir trabajando. Este virus sigue aquí, todavía no hay vacuna ni tratamiento, pero sepan que su gobierno está trabajando por ponernos en la mejor situación posible, dadas las pautas que se han dado a nivel estatal. Entonces trabajaremos juntos, seguiremos necesitando su apoyo y seguiremos trabajando día y noche por proteger a esta comunidad. Muchas gracias. Vamos a escuchar los comentarios del Dr. Shah y después él y yo responderemos preguntas. Dr. Shah.
Thank you, Judge. Thank you for laying out the three-pronged strategy, and I just really want to thank you again for your support. It's been really helpful and meaningful for all of us in public health to really understand that our elected leaders are behind the work that we're doing in public health. So thank you for that leadership and support. My name is Dr. Umair Shah. I'm the Executive Director of Harris County Public Health and the Local Health Authority for Harris County. And I just wanted to underscore a few things that the judge has said. That, again, that we are doing everything that we can in order to fight this virus. We're doing everything we can in order to protect our Harris County community. We're doing everything we can to lay out all the strategies and do as much as we can to really prevent our community from being overrun by this virus. And I want to, again, there's another T in this, which is thank you, which is the gratitude to all of you for helping us be able to fight this virus. We cannot do this alone. We have to do it with everybody together, and it's absolutely critical that we work together on this. As of close of business yesterday, we have now 5,827 confirmed cases in Harris County. We have 98 deaths. In Texas, we now have over 25,000 cases. We would love all of us for this virus to just simply go away. The reality is that as we reopen, this virus is not going away. This virus is still with us, and we have to do everything we can to continue to slow the spread. As the judge has outlined the 3 T's, I want to make sure to remind you of the cornerstone of that, which is testing. It's testing, tracing, and treating. So from the testing standpoint, that foundation is absolutely critical so we can actually go through the next steps. And so we want to urge our community to get tested. You can go to our readyharris.org tool, again, readyharris.org, or call 832-927-7575. Get tested. We're testing in Katy and Baytown at fixed sites. We have mobile testing, as the judge announced yesterday and again mentioned this morning. We're expanding our mobile testing capability. We're doing what we can in congregate settings. We're doing what we can to really even get to homebound individuals. We're doing everything we can to increase testing, but having a test does not help us unless you actually go to get tested. And so please, if you have symptoms, absolutely we want you to be tested. If you don't have symptoms but believe you've been exposed, we also want you to get tested. The key foundation, again, is testing. Once we get a positive result from a test, that then opens up the second step, which is tracing. Contact tracing is a strategy, a tool that's been in the public health toolbox for decades. We've used it globally in cholera and tuberculosis and all sorts of other diseases, but we've also used it here locally, and we use it every single day with Harris County Public Health and the work that our epidemiologists do. The difference is, and as the judge has outlined this is a pandemic. This is an overwhelming number of cases that can potentially come positive if we have the testing occurring in our community. So contact tracing means that a positive test then has, as the judge mentioned, people that individual has contacted with or had contact with, and our job then is to get to those individuals. And that's tough. That's not easy. It is a very difficult, labor-intensive process to identify who the contacts are of that individual and be able to then follow up with them. But doing so and having additional contact tracing capacity augments what we've already done. And so the judge has outlined this, but let me make sure I say it as well. Thank you, because we have quadrupled our epidemiology size at the department, Judge. Thank you for your support on that. Thank you to our county's support on that. We were at 20, 25 epidemiology staff members. We have now gotten to that 80, 90, 100 range. And I really want to thank our leadership for being able to give us that support. But contact tracing is in addition to that, because as we continue to go through this pandemic, we need to continue to understand what's happening in our community, especially as we reopen. So whatever you can do to help us, again, by getting tested, and all those messages around social distancing, wearing facial covering, cloth covering, doesn't have to be a mask, hand washing, making sure you don't go expose someone else if you have symptoms are absolutely critical, because it goes to the third T, which is treating and treatment. And this was always our key message. We did not want to see our healthcare system overrun. And our community has done a fantastic job, so we have not seen our healthcare system get overrun. We need to continue to do that. And the last T that I wanted to add into this is technology. And the judge is such a strong supporter of tech and technology and making sure that we add this all together. So we know that it's not just about a contact tracer or a body or an individual. It's also the data systems and the platforms and the technology solutions. And every day, the judge and I are having some discussion about an innovation globally, or an innovation somewhere across the country, or an innovation somewhere here in Texas. How do we apply that here locally? That's what we are doing. That's what we are doing every single day, is looking at how we can bring technology solutions to augment the work that we're doing. But we can't do it without you. And so again, remember the most important T here, which is thank you. We have to do it together as a community, and that's the only way we're going to be able to get through this. And I do want to make one mention as we go through contact tracing. I want also everybody to know that we're not going to be asking you for personal information such as social security numbers and bank account numbers, things of that nature. That's not what this is about. We're asking for health information that will be protected, and that health information allows us to continue to fight this virus. So with that, I just want to thank you, Judge, again. Thank you to our community, and we're open for questions.
Thank you so much, Dr. Shah. We'll take questions from the press now.
Hi there. Good morning. Thanks for having us here today. One of the things I wanted to just clear up, you're not standing in the way of the governor's plan to reopen the state. This is sort of in conjunction with his plan that he announced yesterday. Is that right? Can you just kind of give us sort of how these two things are going to work together?
Yeah, so we've always talked about how we want to get the economy back on track safely. And this is a plan that we've been developing independently of, the steps taken by other levels of government. Now, because of the governor's announcement, we're having to speed up the timeline on our plan. And the good thing is we had it ready. And so what we've done, as soon as we heard, we said, all right, let's get moving with this. Perhaps surely earlier than I would have done it, but we have it. And so I wanted to share with the community what we are going to do as the economy begins reopening in order to contain and root out as best we can the virus. So this is in many ways a response, but yes, it works hand in hand with the reopening strategy.
And I don't know if you can speak to this yet or not, but a lot of people are talking about those, other people who are not essential workers, the non-essential people, the office workers, the hairstylists, those sorts of people. Do you have any idea at this point when we might see those types of workers and those types of businesses come back online?
Look, all of this has been driven by data. That's the only reason we've succeeded, is as soon as we saw our case counts go up, we took bold, aggressive steps to begin closing things down. Folks did their part, and we were able to curb the bulk of the spread. And the same math stands now. We can't pull a date out of thin air and expect that the virus is going to comply with it. And so right now, the governor made very clear in his order that he's got a particular timeline that he'll be watching. I think for our part, if we see something, we got to see. Remember, the virus has this 14-day period. And so if folks begin coming out May 1st and having too many contacts for us to sustain to where it's spreading too quickly, we won't see that for 2 weeks. Longer than that, right? Somebody that began coming out May 4th, we won't see that until past, through to the end of May. And so we have to be very, very cautious with what we're watching. This is about, within that reopening, how are we going to maximize our chance of success? But I'm certainly in no position to just say, based on a date that I want, that we're going to be able to continue. And I think the responsible thing to do is to watch, and is my sense of the discussions that are being had, is to watch how things go and give it ample time for us to know, are we headed back to where we were, or are we on time to continue the progressive reopening? And that will be successful to the extent that we can contain new cases. There will be new cases. The virus hasn't gone anywhere. All it's done is we've been staying away from each other. So the minute we come back together, yes, the virus will come back. It's just the way it works.
Very good. And also, one of my colleagues wanted to know, there are an awful lot of people right now who are separated from family members. They don't want to go see maybe grandma or grandpa, that sort of thing. What would be your message to them? Is it okay to start resuming those contacts? Is it okay to start having limited scale family reunions and getting back to seeing our loved ones again? Or would you recommend continuing safe distance?
Look, the only tool we have is that distancing, the face coverings. That's it. We don't have a vaccine. We don't have a cure. And so to the extent that folks can continue that distancing, inevitably they will help curb the spread. The next thing we have is if you're feeling sick or think you may have the virus, we need you to get a test so that we can identify you, identify your contacts, and stop the virus right then and there. Nobody wants to be the reason for a second wave. And so that's how you help us not be that person. And so, our recommendations continue to be, the default posture should be to try to keep that distance because the virus hasn't gone anywhere. Now there's going to be a slow reopening, and so, we've got to be very, very, very cautious, and we've got to watch our numbers. And what you can do is, to the extent that you can, be very prudent with your interactions, avoid, if at all possible, and if you think you're sick, get tested.
And then just one last thing to kind of talk about the treatment phase, the third phase again. Does that mean sort of keeping the mobile hospitals open at different sites? Kind of exactly what you're talking about as far as the third phase again, if you don't mind, just a little bit more detail on that part.
So one of the fundamental reasons why we've had to step up and limit contact is because in many other places, the virus and the hospital admissions were growing so quickly that they were overwhelming hospital systems. And so that's what this treatment piece is about, is once we've overwhelmed our hospital systems, you're declining folks from being treated. You're turning people away from the hospital, so you're not treating them. Doctors are having to choose who lives and who dies, and that's not a position we want to be in. By the time you get there, the hospital system pretty much has collapsed. You can't treat other illnesses that you normally would. I mean, it's an untenable situation. And so the way we prevent that from happening is we minimize the number of people that are coming into the hospitals, we keep our case count low, our admissions rates low, and we maximize the capacity that the hospitals have. And so as we wind down the medical shelter at NRG, thankfully we didn't need that last month because people did their part, but that doesn't mean that we won't have a surge in the future. As I said, the virus is still here. So if everybody comes out in full force and doesn't take precautions, and the virus spreads too fast for us to be able to keep up with this framework, we could have another spike, and we could need an emergency shelter. And so what we're doing is transitioning to a local solution now that materials have arrived that weren't available a month ago. So cots we'd ordered, weeks ago finally are here. Ventilators, staff, we finally have the materials to stand up an emergency shelter with local resources as opposed to contracting one out. And so as we wind down the shelter, we're building our own option. But we also need to ask folks to do their part so that the piece about admissions themselves, that those aren't growing too quickly. And right now, we're at about, over 200 admissions a day, which the hospital leaders tell us a bit high, to where we need to be. But you know what? We're gonna do our best within the circumstances.
And I hate to bring up budgetary concerns when you're talking about lives, but the ramping up of the 300 contact tracers, do we know how much that'll cost or where that money will come from?
Yes, we're still estimating exactly the cost because we're looking at volunteers as well. And so obviously the primary concern is health and safety, and the fact that without these contact tracers, it will be impossible for the economy to reopen in a way that contains the virus. If we don't have the ability to contain, to stop the virus in its tracks, it's going to spread all over like it did at the beginning, and the only solution is going to be to close everything back down again. And so we're looking at volunteers, we're looking at existing staff, so we keep our costs to the minimum, but the goal is to get these contact tracers that we need, and of course, additional support we'll take. We need to just build up our army of people that are going to go there, are going to stop the virus in its tracks, and are going to contain it, and contain it from spreading all throughout the community.
Thank you. Judge, can I just...
Oh, yeah.
Before we end, just to underscore what the judge said is about the contact tracing, because we also are struck by the fact that our very people also have to be socially distanced. And so we're going to be utilizing a combination of strategies of in-person going places with the appropriate, personal protective equipment on, the masks and the gloves and those kinds of things, just to make sure that our staff and the people that are volunteering are safe and protected if they have to do an in-person. But we're also, and this is where the tech solution comes in, we're also looking at, are there technology aspects of this that will allow us to do certain things virtually? So there's a combination of the two of those that we have to bring hand in hand in this. And that's why Judge is absolutely right, that there is no stone that we're not unturning, that we're constantly looking at strategies from all over the globe, and I do mean all over the globe, to underscore that whatever it takes for us to protect Harris County, we are going to protect Harris County, we're going to protect our residents, and we're going to look at every strategy that we believe is going to be effective here in our local community. As you know, some strategies don't apply here. Some tech solutions don't honestly work as promised. So we have to be very careful, we have to be very methodical, but ultimately our goal is to continue to protect Harris County residents and to do everything we have to in order to be able to do that. So I just wanted to make sure to underscore that.
Thank you.
Judge, question from Telemundo.
Yeah.
Durante los fondos que vienen del gobierno federal, ¿usted piensa usar esos fondos para combate de COVID-19 o dar esos fondos para la próxima presupuesto?
Hemos recibido fondos del gobierno federal, unos 400 millones de dólares, y realmente ya el condado casi ha utilizado esos fondos en todos los trabajadores que están trabajando literal día y noche, 7 días a la semana, en los materiales que hemos tenido que obtener para la comunidad, equipo de protección para los hospitales, públicos, todo esto. Entonces, hoy en la Corte de Comisionados estaremos evaluando exactamente a dónde irán esos fondos, porque obviamente el gobierno federal ha dado ciertos parámetros en qué se puede utilizar y qué no, pero es un alivio para nosotros porque pues nuestro presupuesto local es limitado y esta ayuda federal nos ayuda a poder cubrir más gastos del coronavirus. Entonces, si esos fondos federales irán totalmente a gastos del coronavirus, los cuales ya van en bastante altos, particularmente por simplemente el tiempo que cientos de individuos están trabajando por proteger a la comunidad. Okay, thank you all so much. Appreciate it.
And there you have it, Judge Hidalgo unveiling a new 3-part plan as Harris County is still the epicenter for positive cases in Texas. She's concerned about a potential second wave, and she hopes this new framework will help. Part 1, testing. They will be expanding mobile testing. Part 2, tracing. She hopes to recruit 300, hopefully volunteers, as contact tracers who will then reach out to people who have been infected. And Part 3, she said, is going to be the toughest part of that plan, treating this. She wants to ensure hospitals have what they need in case a second wave does hit our city. All of this happening as Texas has now hit 25,000 positive cases. You can get more detailed information on our website, khou.com, and also by texting the word FACTS to 713-526-1111. And of course, we will have a wrap up for you on KHOU 11 News at noon. Thank you for joining us. I'm Stephanie Simmons. Have a good day.
Of use or turn up the resistance. Your QB comes almost completely assembled, and it's perfect if you're just starting on your quest to revive